One of the biggest misconceptions about back pain after 50 is the belief that rest is the best medicine. While rest can help after an acute injury, long-term excessive rest actually reduces spinal circulation, weakens stabilizing muscles, and makes stiffness worse over time. Inside the body, this creates a cycle where less movement leads to poorer blood flow, and poorer blood flow leads to slower tissue recovery. Another common mistake is relying only on painkillers or topical creams. These may temporarily reduce discomfort by blocking pain signals, but they do not address the underlying issue: loss of disc hydration, muscle tightness, and reduced spinal mobility. As a result, the pain keeps returning because the root biological problem is still active. A third misconception is doing random stretching without structure. Many seniors attempt general stretching routines found online, but without targeting deep spinal stabilizers or timing movement correctly before sleep, the benefits remain limited. In some cases, improper stretching can even irritate already compressed nerves. Clinical experts in geriatric rehabilitation emphasize that chronic back stiffness is not simply a sign of aging. It is often a sign of reduced functional movement patterns. The encouraging part is that this type of decline is not fully permanent. Research in movement therapy shows that even in older adults, gentle and consistent activation of spinal muscles can restore flexibility and reduce stiffness over time. This opens an important medical gap. Most standard advice focuses on managing pain, not restoring spinal function at the biological level. Before we go into the specific bedtime movements, it's important to understand that not all gentle exercises produce the same effect on spinal recovery. Some improve circulation slightly, others help muscle relaxation, and a few directly influence spinal decompression and overnight repair. Let's rank them from the least effective to the most impactful based on how strongly they support back pain relief and nighttime spinal recovery. 10. Light seated forward bend. Basic relaxation stretch. This movement gently stretches the lower back and hamstrings, slightly improving flexibility. It can increase local blood flow by around 5 to 10%, but the effect is temporary. The limitation is that it does not activate deep spinal stabilizers. Verdict: helpful for relaxation, but not enough for chronic stiffness. Number 9. Knee to chest hold while lying down. This position reduces lower back tension and helps decompress the lumbar spine slightly. It can reduce perceived stiffness by around 10–15% after consistent use. However, it mainly provides passive relief and does not strengthen supporting muscles. Verdict: good for short-term relief, limited long-term impact. Number 8. Gentle spinal twist in bed. A slow, controlled twist improves spinal mobility and supports fluid movement between vertebrae. Studies suggest mild improvement in spinal flexibility and circulation. The downside is that incorrect form can irritate sensitive joints. Verdict: useful if done carefully, but technique dependent. Number 7. Diaphragmatic breathing with spine awareness. This technique activates the parasympathetic nervous system, helping the body relax before sleep. It indirectly reduces muscle tension and stress-related stiffness. It may improve sleep quality and reduce pain sensitivity by up to 15–20%. However, it does not directly decompress the spine. Verdict: excellent for relaxation, indirect spinal benefit. Number 6. Pelvic tilt movement in bed. This small controlled movement activates core stabilizing muscles. Over time, it helps restore lumbar alignment and reduce morning stiffness. Clinical rehabilitation data suggests up to 20% improvement in lower back stability with regular practice. Limitation: requires consistency to see results. Verdict: strong foundational movement. 5. Supine leg elevation, legs on pillow support. This position reduces pressure on the lumbar spine by improving venous return and reducing disc compression overnight. Many seniors report noticeable reduction in morning stiffness. It can improve spinal decompression efficiency by around 20–25%. Limitation: passive method, no muscle strengthening. Verdict: highly effective for overnight recovery. Now we move into the most important part, the top movements that actually combine circulation, decompression, and deep muscle activation, which is why they are commonly used in Japanese elder nighttime routines. For 4, gentle knee rocking side to side. This movement mobilizes the lower spine and improves synovial fluid circulation between vertebrae. It helps reduce stiffness buildup from the day. Improvement range, around 25% in flexibility perception. Limitation, must be slow and controlled. Verdict, excellent mobility reset. Number 3, bridge hold, very gentle glute activation. This activates glute and core muscles, which support the spine during rest. Stronger posterior chain support reduces spinal load during sleep. Clinical rehab data shows up to 30% improvement in lower back support function over time. Limitation, may feel slightly tiring for beginners. Verdict, powerful structural support exercise. Number 2, slow spinal decompression stretch, lying lengthening technique. This involves elongating the spine gently while lying flat, creating space between vertebrae. It helps disc rehydration and reduces nerve compression pressure. Reported improvements in morning stiffness can reach 30–40% with consistency. Limitation, needs mindful execution. Verdict, very high impact for pain reduction. Number 1, Japanese-style full bedtime spinal reset routine, combined micro movements. This is not a single movement, but a sequence. Pelvic tilt, gentle knee rocking, slow decompression breathing, and supported leg elevation. Together they create a complete spinal recovery environment before sleep. Research in movement therapy suggests combined routines are significantly more effective than isolated exercises because they address circulation, muscle tension, and spinal alignment simultaneously. Improvement in morning stiffness and mobility can reach 40–50% over consistent practice. Limitation, requires 5 to 8 minutes of nightly discipline. Verdict, most effective and sustainable method for long-term spinal relief. Now that we understand the ranking, let's focus on what actually creates the strongest improvement in real life. The top 3 bedtime spinal recovery methods that work together to reduce stiffness, improve circulation, and support overnight healing. Number 3, bridge hold, gentle version. This movement strengthens the glutes and lower back support system. Lie on your back, knees bent, feet flat. Slowly lift your hips just a few inches, hold for 5 to 10 seconds, then lower. Repeat 5 to 8 times. It helps the spine by reducing pressure load during sleep. Harmless side effect, mild muscle fatigue in beginners. Caution, avoid lifting too high if you have severe spinal arthritis or recent injury. Number 2, slow spinal decompression stretch. Lie flat on your back, arms relaxed, and gently lengthen your body as if you are being stretched from head to toes. Hold for 1 to 2 minutes while breathing slowly. This encourages disc space relaxation and reduces compression pressure that builds during the day. Harmless side effect, temporary feeling of stretch sensitivity. Caution, avoid forcing the stretch. It should always feel gentle, never painful. For 1, Japanese-style bedtime spinal reset routine, core method. This is the most powerful approach because it combines multiple effects: pelvic tilt for core activation, gentle knee rocking for mobility, and leg elevation for decompression. Exact routine, 5 to 8 minutes total before sleep. First, perform pelvic tilts for 1 minute, slow and controlled. Next, gently rock knees side to side for 2 minutes to loosen spinal joints. Then lie still with legs supported on a pillow for 2 to 3 minutes while practicing deep breathing. This sequence works better than isolated exercises because it targets all 3 key systems: circulation, muscle balance, and spinal pressure relief. Over time, this improves nighttime recovery efficiency and reduces morning stiffness more consistently than single movements alone. Medical experts in rehabilitation emphasize that consistency matters more than intensity. Even simple routines like this, when done daily, can significantly improve functional mobility in older adults. Before finishing, there are a few critical mistakes that quietly slow down recovery. First, going to bed completely stiff without any movement. Second, relying only on pain relief methods instead of improving spinal function. Third, sitting for long hours during the day without breaking movement cycles. And fourth, ignoring morning stiffness as normal aging. The key reframe is simple. This is not just aging, it is reduced spinal function and circulation that can be improved with daily habits. For the next 30 days, focus on one consistent goal. Perform the Japanese-style bedtime spinal reset routine every night to support mobility, comfort, and long-term independence.